Schizophrenia.
Oh, schizophrenia. If you'll put it in my chat box for me, guys. Okay, so bipolar, schizophrenia, and yes, I'm recording cases. Thank you. About the clusters, ADHD, panic disorder.
Depression, anxiety.
Thank you. But if you'll put it in the chat box for me, I'd really appreciate it. This is the point why don't you not to talk for a little bit. Okay, I'll put it in the chat box. Okay. So the major ones. So that's what we're going to do tonight is really go over the major ones and really look at what it looks like on a test and what to look for in a question. Okay. So again, I'm going to ask you just to keep your questions to yourself just for a little bit. You can put in the chat box. After I talk about it, I'll open it up for questions and we can definitely go back to it. But let me just get a good chunk of lecturing in. So when you go back, you can come back and you can watch this. Okay. So I'm going to also try to tie it into theories. What theory is evidence-based, right? Which one says this is what we should use. I'm going to start off with bipolar. Okay. So most people know that most general people know, people who are not professionals, lay people, realize that there is a bipolar. So we need to know that there's a bipolar I and a bipolar II, as well as a cyclothymia. Okay. So I'm going to share the screen. Okay. So what you're looking for in the test is the time frame. They're giving you the time frame. If you've had me before, I'll tell you it's a reading test. They're going to tell you in the question, it's been 2 weeks, it's been 7 days. So that's what they're giving you. You have to know the time frame as well as the behavior. So bipolar I. So that is going to start off with a major depressive disorder. Major depression is always 2 weeks. 2 weeks, can't get out of bed, overeating, undereating, want to kill myself, suicidal thoughts. The diagnosis is 2 weeks. So then I've got major depression and they put me on an antidepressant. Maybe I am sharing. If you don't see it, go out and come back in. Okay. So I've got this depression, and what the question may look like is Pam begins, she's irritable, she can't sleep. They take her off the medicine and she keeps getting higher and higher and higher. A full blown manic episode is 5 to 7 days. Okay. So, and when I say 5 to 7 days, that means I cannot sleep. I am sleeping with everybody I know. I'm shopping. I'm stealing people's cars. I'm doing all of those things. If you've seen my videos, usually I'll tell you, I had a client one time and she was telling me about her mother, a wealthy family, upstate New York. And her mother was bipolar and she would come pick her. She was like 8 or 9 at the time. And she's my age, so a long time ago. Her mother would come pick her up from school and they would get on a plane and fly to like Paris or London, any place. And her dad had no idea. And at the time, there were no such thing as cell phones, right? And she's a little kid. How do you dial international? So really, she said what it was like is like we would come home. She'd pick me up. We'd go shopping. We'd have this great couple of days, and then she'd crash. She'd be in bed for a week. Okay, so imagine that being a little kid.
Paulette.
Okay, Paulette, let's make sure you unmute ourselves.
I'm doing okay. How you doing? Mm-hmm. Yeah. Uh-huh.
Paulette,
Yeah.
Paulette,
Yes.
you want us all to hear your conversation?
Oh, I'm sorry.
I don't mind. We can keep talking about it. I'm going to mute you. Okay. If you get bumped out, come back in. Okay. So when you come back in, be sure that you mute yourself. Okay. So that is going to be my full bipolar I. 2 weeks of the major depression. I'm going to hit a peak where I most often end up in the hospital or in jail. Okay. Bipolar II. Bipolar II has hypomania. HYPO means less. Okay. So hypomania is 4 days or less. People might not even notice if you have hypomania. So I'm still going to have the 2 weeks of depression, right? And then my mood will lift. And then, but it doesn't go all the way to a full-blown manic episode. It's just like, have you noticed that every few days Pam's in a really good mood? Like, oh my gosh, you know what? Pam, like, she'll like go shopping and buy the office lunch every once in a while. So it's not necessarily that noticeable, but it's definitely an increase in mood. Hyper, Hyper, means more, right? Hyperactivity, Hypo means less. Okay, so I have less of a mood. So the key I'm looking for in the question is hypo and the times, 4 days or less. Okay, so then you will see there's something called cyclothymia as well. Cyclothymia and dysthymia used to be the same thing. It's now called persistent depressive disorder, but the time frames are the same. And what you're looking for is, does a client have more ups or more downs? So it's 2 years in adults, 1 year in children. And the question will say, for the last 2 years, Pam has felt like she can't get out of bed. She's always tired. Life is a drag. Okay. So that's going to be my PDD, my lower one, 2 years in kids, 2 years in adults, 1 year in children. Okay. And again, and in the question, I'm definitely looking for those numbers. Cyclothymia, I have more of the highs, more manic episodes or more hypomanic episodes. 2 years in adults, 1 year in children. Exactly the same. I'm going to treat lithium. Lithium is the treatment that we've used forever. Lithium is probably still on the test. However, if it is not, we're looking at a Depakote, a Tegretol, Lamictal, any of my anti-seizure medications. Okay. I'll also tell you during this time, I speak so fast. So go back and write it again and take notes, because I'm really trying to spill everything I can into your brain in this hour and a half. Okay, so cyclothymia, bipolar 1, bipolar 2, I'm going to take a mood stabilizer, which is most often lithium. And lithium is not there. I'm looking for an anti-seizure. Those are my Tegretol, Depakote, Lamictal. And you might see again the question about lithium. Lithium, you have to have your blood taken every so often because it builds up toxicity. It's like swallowing a lithium battery. Okay, so that you can die from that. So they're watching that. My depressive disorders, right? I'm going to take one of my antidepressants, and I'll give you a list of the medications, but a Prozac, a Paxil, a Pamelor, any of those things that are definitely, and I have a list. I'll send the list with it. Okay, so knowing what I'm looking for. In general, any mood disorder is the treatment evidence-based. The right answer for the test is CBT and medication. Okay, so depression, right? Depression, I'm going to get CBT because that's Beck. Beck said, depression is not a real thing. It's the stinking thinking. So I'd use this. And then on top of that, I'd be prescribed probably a Prozac, a Paxil, citalopram, any of those. And you really don't need to know the generic names. You just need to know the names that we go by. Okay, what you see on TV. That's the names you're looking for. Okay. Everything I use, I will put a copy in your chat box. It'll be here for 30 days, as well as a copy of the video. So everything will be here for 30 days. Okay. So like I said, in general, unipolar is bipolar. I'm sorry, unipolar is depression. And you might see that. Thanks for bringing that up. So unipolar is depression. I only have one. It doesn't go up. It doesn't go down. It's just one thing. So bipolar used to be called manic depressive, right? So up and down. So unipolar just means down. Okay, good question though. So yes, there will be medications, and I'll give you a list. What I said though is you don't need to know like the generics. You need to know the name you see on TV. Right? You're not looking at this whole medication test, but yes, you do need to know the medications, and I'll provide a list with that as well. Okay, so then, so like I said, CBT, that is the right answer for an affective, AFFECT, affect, that's your mood, the way look on your face. So you'll see affective disorders or mood disorders. Now let's talk about, so we know that generalized anxiety, GAD, that is 6 months, right? 6 months free floating anxiety, not really sure what causes it. And the question, it just says it kind of happens. There's not a predictor, right? There's nothing that we know that happens. So GAD is an anxiety disorder. So when we have GAD, 6 months free floating, that you might get a question of what is the best medication or what is the one I can take every day. Anytime I have anxiety, a benzodiazepine is the best, right? Oh my gosh, like give it to me now, take me down. You've seen the on the in the hospital on TV shows, they give them like 2 cc's of Ativan, right? Of course it does. However, that is not the one I can use every day. So while that may be the best one, it's going to get me down very quickly. It is not the one I can take every day. So the body does not see your inside of your body does not recognize any difference between depression and anxiety. They're still both mood disorders. So we're going to prescribe an SSRI, and that's going to be Zoloft. That's what I'm looking for is Zoloft on the test, the one that you can take every day. Okay. So with GAD, sometimes it'll escalate and we'll end up with a panic attack. A panic attack, you'll know in the question because my heart is moving, my heart is pounding, it is real. Tachycardia, it is like, oh my gosh, it's beating, it's beating, it's beating. I end up in the hospital, emergency room sometimes, and they can find nothing wrong, no organic source. That's what that means. They can find nothing physically wrong, but literally you are having tachycardia. Your chest is out. People besides you can feel it. It's a real thing. So then, for that, again, if I end up in the emergency room for that, they're going to give me a benzo to calm me down, right? Slow my heart rate down. Then we're going to look at, again, going back to one of those Zolofts or things like that. The panic attack is just having one. Panic disorder is having one and worrying about it for another 30 days. So you might see in the question that Pam sits in the parking lot of the hospital because she's so afraid she's going to die. Okay. So that is panic disorder as opposed to panic attack. Again, those are anxieties. Those are mood disorders still. Okay. So quick, short, and easy, benzodiazepines. Long haul, we're going to do a Zoloft. Okay. The benzos, of course, are addictive. So that's why we try to stay away from those. Okay. So we've talked about depression. We've talked about bipolar I, bipolar II. We've talked about cyclothymia, dysthymia. I just talked about panic disorder. I'm going to go back up to my list. Okay, let's see here. Let's get through ADHD. Let's go through childhood disorders in general. Okay. I'm going to pull up. I teach numerous disciplines. So I'll use books from either one, whether it's a social work book or whether it's a counselor book. I promise you the DSM is a DSM. It will not change. Wherever it says social worker, you can just put in counselor if it makes you feel better. Okay. So I'm just going to go over the DSM. I really, I don't understand why we still have the difference. We have had the DSM-5 for going on 15 years. Most of you have never even seen a DSM-4. I was schooled on the DSM-3R, okay? But sometimes you still get those questions of the difference. So I'll mention a couple of those as well. So when it comes to childhood disorders, neurodevelopmental, that means it happens, my brain, neurodevelopmental means while my brain is developing. Okay, so those are my childhood disorders. That's going to be having some lower IQ, some of those language issues. Okay, ADHD is in there as well. Autism, it's on the spectrum. I'm sorry, autism is on the spectrum now. It used to be like um, um, Asperger's, but now you're somewhere on the spectrum. Okay. Learning disabilities. So if in a question you're reading and your little Johnny is in school and little Johnny is struggling with paying attention, but it also says that little Johnny gets really high grades in English, but is failing math, or Johnny is really sort of really high on a standardized test, right? Okay. Then I'm going to look at there's something going on. So if it talks about having difficulties in school, difficulty understanding, okay, that is going to be the learning disability, not ADHD. Remember, with all of my behaviors, I'm looking for a cross environment. So the question's going to say, Johnny can't sit down. Johnny raises his hands. Johnny is impulsive at home and at school. Okay. So that's what I'm looking for. And of course, we're going to use a stimulant, an Adderall, a Ritalin, one of those things. We also might use biofeedback. So biofeedback therapy is used for anxiety disorders as well as treating my ADHD. Biofeedback, you're hooked up to those electrodes, and the goal is it's like a game for some kids. You're trying to like keep the car under the line, right? So you're trying to do that and you control it with your respirations. So you're trying to keep your heart rate down, all those good things. So eventually the goal is you can do it by yourself. Okay, so biofeedback therapy is used for ADHD as well as anxiety. And the goal is to kind of train your body to slow down your heart rate, to slow down your pulses, all of those things. Close up the windows. Okay. You might see, I'm looking for, it is childhood disinhibition disorder. What that means is that children who they're not afraid of strangers, and not in a good way. Dissociative disorder. There we go. Okay, so really, what they're kids who really have not bonded with anybody, and they will come up and talk to strangers and not be the least bit afraid. They'll want to go home with you. Okay, so when we look at Margaret Mailer, she is our object permanence. She talked about the relationships between mom and children and bonding. She said that if you don't develop that between that object constancy between the ages of 2 and 3, that you could really end up with some of these disorders. Reactive attachment disorder, again, the social disinhibited disorder. She said maybe even conduct, things as well as like borderlines, all of those things from really not being able to have that one-on-one, having that object, the constant object, which is your mother or your caregiver in your life. Tourette's is a tic disorder. Tourette's is also when I have anxiety and when I'm stressed and I get anxiety, it increases. Okay, so to treat a tic disorder, I'm also going to use a anti-anxiety, an SSRI, not a benzo. Okay, so you might see something about the more anxious he gets, the more the words come out. Okay, so I'm treating that the same way. So when it comes to my schizophrenia, let's look at those. So brief psychotic is going to be from 30 days, so 3 days to 30 days. Usually have like, okay, so it is from 3 days to 30 days. On the 31st day, it becomes schizophreniform. Schizophreniform is a form of schizophrenia. Okay, so that's going to last from 1 month, 30 days to 6 months. What we're really hoping is that it goes away. We're really, really hoping that, oh my gosh, my baby has schizophrenia, and we're hoping that nothing ever happens of it. You'll get a call. You might see a question. The mom gets a call from the school because her 17-year-old daughter is dancing naked in the fountain, right? She's responding to external stimuli. Hallucinations, those are what I see. All 5 of my senses can hallucinate. I can smell things. I can see things. I can taste things. Olfactory is I can smell. And gustatory is I can taste. So what you might see is, they're trying to poison my food. They're trying to poison my food. So, and it's across environments. It's not just one place, it's across environments. So that's what makes you think it's going to be schizophrenia. So then the hallucinations, thoughts, things outside of my head, delusions are inside of my head. I have to have both of those to be to have any of these diagnoses. So again, brief psychotic, less than 3 months. Schizophreniform, a form of schizophrenia, and schizophrenia, which is a full-blown 6 months. Okay. So then you might see a question that talks about if you have your first psychotic break after the age of 45, you're less likely to have another one. Okay, that is true. That is true. Um, um, when it comes to treating schizophrenic, there's talk therapy is not going to work. Okay, there's enough voices in my head already. Yes, there's a way to remember them. Go over it for the next 6 days, every 3 times a day. It's that simple. I tell you, people, everybody around you should know that you're taking this test. Do you know how alcoholics, when they stop drinking, they still smell like alcohol? Everybody around you, you should smell like the NCE every minute of every day until you take that test. Have your kids involved. There should be sticky notes. Everybody should know. Call your kids Freud, call them Maslow, whatever it takes. It will not hurt your children and your spouse to get involved in this. This is this important. If you only want to do it one and done, all you need to do is this and breathe. Okay, that's all I need. The kids will be fine, and they work your job. But honestly, this needs to be your. So, schizophrenia. Of course, I'm going to use my schizophrenia, my Risperdal, Trazodone, Haldol.
Dr. Pam, we can't hear you.
How about now?
You can. I can hear you.
Okay. Okay. Thank you much. Thank you
Can
much.
hear you
Okay.
now.
Sorry about that. Thank you. Okay, so I was talking about tardive dyskinesia. Tardive dyskinesia is a side effect of the antipsychotics. So it is through your all of your body, but it's most you'll see it most on the client's face. It is a central nervous system disorder. It is not a muscle disorder. It's central nervous system. It's the way that the medication affects your brain. So then it can be reversed. Once you stop taking the medication, it can go away. There's also a medication called cogentin, and cogentin is something you would take on top of your antipsychotic so that we could control some of those facial movements. You might see a question about deinstitutionalization. One of the reasons, and we've gone through this a couple of times. So one of the reasons that we can do, so tardive dyskinesia is a side effect of the medications for schizophrenia. Okay, that's where it comes from. Okay, so then I was talking about this deinstitutionalization. So deinstitutionalization happened when the last time it happened is because we came up with the injectables, right, or the long-term pills, so that people with schizophrenia don't have to come and show up every day to get medication, right? So that's deinstitutionalization, okay? So I'm going to tell you that it's recorded, and you should still be able to hear me because I was speaking, I think. But if not, remind me and I'll come back to it, okay? I just want to get everything in. Okay. Okay. So schizophrenia, I talked about schizophrenia. I talked about brief psychotic. I talked about schizophreniform, and schizophrenia, it's full-blown schizophrenia. Okay, I'm going to come back to schizotypal because those are personality disorders. So I'm going to hold on to those just a minute. Okay, schizoaffective disorder is a combination of both. It's schizophrenia as well as a mood disorder. Okay, so I have full-blown schizophrenia, and then I have bipolar I. To be honest with you, I'll always tell you that I only see it in hospitalization or in prisons, in institutions. I've never seen it in the real world. My own personal theory is because if someone is institutionalized and I'm giving you both lithium and antipsychotic, you're a walking zombie, right? In the real world, and this is not a test question, but in the real world, most often you're going to see bipolar I with psychotic features, because you can have psychotic features on either end of bipolar, the highs or the lows. Okay, so most often that's what you're going to see. But schizoaffective disorder, again, I have both bipolar I and I have bipolar I, and I also have the major affective disorder, the mood disorder. Okay. Let's see here. Again, the bipolar and related issues. I talked about the manic. I talked about the depressive, bipolar I, bipolar II, cyclothymia. Let's see here. Those are the major ones. So depressive disorders. So DMDD. So that we used to really talk about children with bipolar. We don't see that a lot. We don't use that a lot anymore. So disruptive mood disorder really means it's the extremes, right? I overreact. I get really mad when you tell me that I can't do this, or I cry for no reason. It's very extreme. So DMDD is whether it's the highs or the lows, the crying or how they're reacting is nowhere near what the behavior is. Okay. Separation anxiety disorder, that's mostly seen with children. Okay, so separation anxiety disorder is mostly seen with children. And what you're looking for is, the mother drops the child off at daycare, and the kid cries and wants to be picked up the entire time. Okay. Social anxiety phobia. So it's now social anxiety disorder. Okay, the social anxiety disorder, I think that is 6 months. So symptoms, yeah. So the symptoms must be persistent, lasting 6 months or longer. Okay, so DSM-5 says that social anxiety disorder, which is different than any of my other personality disorders. So any of my social anxiety disorder would be ego dystonic. Ego dystonic means that I'm going to seek treatment. Ego syntonic means that I am not seeking treatment. Okay. I talked about panic attacks. You can have panic attacks with agoraphobia. Agoraphobia is when you're afraid to leave the house. You're afraid of large areas. On the question, it might say that Pam goes to work every day, but comes home and she hates leaving her house. So that can still be agoraphobia. I leave my house, but I don't do anything else. Don't think I necessarily have to stay in my house the entire time. I really can leave my house. Okay, we've talked about GAD. OCD, so let's talk about OCD. So some of these are anxiety disorders. So obsessive-compulsive, and we'll talk about the difference between OCD and OCPD in just a minute. But some of my anxiety disorders, you're going to find like trichotillomania when you pull your hair, excoriation when you when you're picking at your skin. Okay. What else? Trichotillomania, no, not stealing. That one, the one we saw all the time, it's also considered an anxiety disorder. Hoarding is an anxiety disorder. Okay. So where we're going to treat those again with CBT and medication, because those are underlying anxiety disorders. People can't get rid of their stuff because it creates anxiety. If you used to watch Hoarders when it came along when it first came on, they would clean the people's houses and not do any mental health treatment, and they would come back and the house would look like the same way it did. It was like within a year. Okay, so it's an anxiety disorder. So that's what we're teaching. That's how we're treating. That's how we treat it. So again, trichotillomania, excoriation, those are anxiety disorders. So I'm going to treat them with CBT and medication. And again, that's going to be Zoloft, what I'm looking for. Okay. PTSD, an acute stress disorder. PTSD has to be after 30 days. Acute stress is up to 30 days. So what happens is something awful happens in my life. I see something, and all of a sudden, I am extremely upset. My house burns down. I lost my spouse. I lost my job. That is traumatic. So 3 days to 30 days. Okay. That is really going to be, that's what's going to go on. That's that. Okay. Then after, on the 31st day, if I'm still having those nightmares, I'm having flashbacks, all of those symptoms, then it's going to become a PTSD, a post-traumatic stress disorder. The treatment of choice for PTSD is going to be EMDR. Okay, that's the empirical based. That is the one that works for post-traumatic stress disorder. Okay. So EMDR really has to do with it's that rapid eye movement. And I probably have a couple of specialists in this group. So if I'm wrong, be sure and tell me. So the EMDR, the goal is to bring up the incidents, right? Bring up the fear, think about the trauma, and you're having that constantly on your chest, like right here, thinking about it, thinking about it, thinking about it. At the same time, the therapist is going to ask you to keep an eye on her, to keep your eyes on her finger as it goes back and forth, or a clock, or anything else. The eventual goal is that my brain can't do both of those things at the same time. So it's kind of tricking my brain to break this up, this pain, into smaller pieces. Okay, so EMDR is the treatment for PTSD. And what I'm looking for in the question is I can't see, I can't sleep, I'm having flashbacks, all of those sort of things. DID, that used to be MPD, okay, multiple personality disorder. DID is really when I am, I've disassociated. If you remember the movie Precious, whenever she was getting raped or awful things were happening to her body, it would go to the scene where she was beautiful and she was dancing. So we believe that dissociative disorder, DID, is really to protect your body, that your body leaves, kind of your brain leaves your body to protect your body. So you might also see these terms. So depersonalization or derealization. Depersonalization feels like it's not my body. That's not me. I can see this happening, but it's not my body is not there. Derealization is if the event doesn't seem real. Okay, this can't be real. This can't be real. So those are the terms. Depersonalization is that can't be me. It's like I'm watching my body do something, and derealization is that the issue, the event can't be real. Some somatoform disorders. So soma means body. So anytime I see a somatic syndrome or any of those somatic disorders, what it really means is I have got a mental health issue that is coming out as a physical issue. Okay, because soma is my body is showing it. So illness anxiety disorder, that used to be my hypochondriasis. Okay, so illness anxiety disorder is I have a oh gosh, I have a little bitty mole on my finger, and I'm pretty sure it's cancer. Okay, so it used to be called hypochondriasis or hypochondriacs. Conversion disorder is a central nervous system disorder. So what happens is something traumatic happens, you can't see, you can't walk, and there's no organic reason. And when I say organic, that means there's no physical reason. The doctor has run tests and they can't figure out what's going on. So I always use the book Maya Angelou, her story about I Know Where the Caged Bird Sings. And what she shares is when she was little, she was staying with relatives, and the relatives, somebody in the neighborhood raped her, and she went back and she told the family, and the family went out and killed the man. So she said that she believed that her voice killed somebody. So she didn't speak for 6 years. Okay, that is a conversion disorder. What I'm looking for is I see something traumatic, right? I see a kid get killed. I see something, and then a part of my body doesn't work. Factitious disorder is I am faking it. I'm faking it. I'm faking it. Okay, so the difference between factitious and malingering is I'm faking it for a reason. Malingering is I'm trying to get Social Security. Malingering is I'm trying to, not go to work for a couple of days. So there's a reason for that one. Factitious, we're not really sure why people do it. They're totally faking it. Okay. Malingering is not considered a mental illness, and it's a V code, but you won't see it on the test. So malingering is really when I'm trying to get something out of it. Feeding and eating disorders. So anorexia is egosyntonic. That means it's in sync with my ego. Okay, and those terms are egosyntonic and ego-dystonic. And you can also see ego alien. So my ego, remember the ego, if we go back to Freud, have my id, ego, and superego, right? The id is my devil on one side going, yes, Pam, do it, do it, do it. And on the other side is the angel saying, no, Pam, never, 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 never. The ego is the reality principle. That's me in the middle. So when I see ego strengths, ego alien, it's just me. Erickson talks about ego integrity, the last stage of life. So that's all that means. So if it's egosyntonic, it's in sync with my ego. Okay, I don't see a problem with it. All of my personality disorders are egosyntonic. They think there's nothing wrong with them. It's all you. All of my other disorders are ego dystonic. That means that people are coming. They don't like dis. You might also see the term ego alien. So ego alien also means the same as ego dystonic. So the goal is to take those personality disorders and to make them ego alien or ego dystonic and comfortable with your ego at this point. So anorexia is the only disorder that is also ego syntonic. My anorexics always think they're fat. They can weigh 3 pounds and they have body dysmorphic disorder, right? They look in the mirror and they swear they're like 150 pounds and they're really 3. So anorexias are thin. You can, and the question they'll tell you, they are very, very thin. Anorexia, when they don't have their period, you might see that in there. And the most often what you're looking for is to seek medical treatment right away, because that is life and death. That's where safety comes first. My bulimics, on the other hand, and into the other, my bulimics and my binge eating people, they don't look any different. They look the regular size. Okay, so if it says she's a average looking person, so she's not anorexic. Anorexics are tiny, tiny, tiny. So rumination disorder, let me back up. Pica is eating anything but food. Pica is much more common with people who have lower IQs. So people that have intellectual differences are more likely to eat things that are not food. Rumination disorder, that is also an eating disorder as well as a thought process. So rumination in the thought process is I can't get rid of this thought. I'm going to keep over and over and over thinking about it. The eating disorder is when you put food in your mouth and you chew it, but you can't swallow it. Most often they'll say it's a texture thing. So they will swallow it and regurgitate it or spit it back in their hand and put it back in their mouth. Grossest thing ever. Okay, you can YouTube it if you want to. We used to think that it only happened in children, and now we know that's adults as well. Okay. So my bulimics, like I said, they are normal. Let me get that back. So anorexia, that no longer is a requirement. So not having your period, that's what that word means. That's no longer a requirement when it comes to anorexia, and I apologize for that. My bulimics, again, so they're going to eat. They're either going to throw up or they're going to exercise. It may say that she exercises, 15 hours a day, and she eats and throws it up, or she eats and exercises. That's bulimia nervosa. Binge eating, you are not throwing it up. You're just eating, but not throwing it up. Enuresis and encopresis, you poop on yourself. So we're not worried until children age of 4 if they're not potty trained. So enuresis and encopresis are diagnosed at the age of 5. Okay, so it can mean having accidents or purposely pooping someplace that's not appropriate or purposely peeing. So coop is poop. Encopresis. Think of feces. Encopresis, poop. You might see this one, the circadian rhythm. All that means is, we're made to go to bed when the sun goes to bed. When the sun goes down, we're made to get up when the sun comes up. Right? So if things change, then I might have a change in my circadian rhythm and I can't sleep, or I'm stuck. If I work the night shift, I can't sleep in the day. Okay. A couple of the sexual dysfunctions you might see in there. I don't know. You might see, anybody seen any of the pedophiles, the frauderism, fetishistic disorder, any of those sexual disorders? Okay, I didn't think so. Gender dysphoria, okay, and that's where we'll find all those new LGBTQI terms as well. Gender dysphoria means that dysphoria means unhappy. I am unhappy with the gender I have been assigned. So what I have between my legs, let's say I have a vagina, and I don't think that I am a girl. I'm unhappy with the gender society has assigned me. Okay, so that's what that means. is I'm unhappy with the gender I was assigned. I believe that I am a girl, and I may have a penis, but I still believe that I'm a girl. Okay, so that is gender dysphoria. Let me throw in a couple of those other terms, because you'll see those usually on the diversity chapter. I'll put this in the chat box as well. So in the diversity chapter, that's where we're seeing a lot more of the LGBTQIA questions, right? What I want to point out is, so first of all, there's orientation. That is who I'm attracted to. That's who I'm sleep with. Gender is what I have between my legs or how I see myself. So cisgender, C-I-S-G-N-D-R, that means that what I have between my legs matches how I see myself. So I have a vagina and I believe that I'm a female. I am cisgender, right? So transgender means that I am somewhere on the spectrum of changing the gender I was born with. Okay, I could just be dressing as the other sex. I could be in some sort of the surgery. I could already had the surgery. So I am changing the gender that I was. That's transgender. Non-binary, that's where you're going to see they. Okay, so he, she, and they. That means I'm not labeling myself as male or female. Okay, I am not either. I'm non-binary. You might see, so Latina and Latino used to be male and female terms for, vocabulary in Spanish. And now we're saying Latinx. So all that means it's not boy or girl, it's just X. That's term is non-binary. Okay. Intersex, that term used to, it was called hermaphrodite. That's a bad word now. We do not use the word hermaphrodite. Intersex is the best answer. Okay. I'm going to put this in the chat box, guys, and discuss that more in the diversity chapter. Okay. So my childhood disorders. So conduct disorder is the ones who are breaking the law. What you're looking for in the question is they are law breakers. They're stealing things. They've vandalized people's houses. They've hurt animals. They've breaking the law is what I'm looking for. They have no remorse. Okay. The difference between my conduct disorder and my oppositional defiant disorder. My opposition defiant disorder kids are not usually lawbreakers. They're mean, they're mad, they want to get you, but they're not lawbreakers. Untreated conduct disorder turns into antisocial personality disorder. Okay, and antisocial does not mean that I don't like people. Antisocials love people. They love to eat you, have you over at your house and eat you and kill you. My serial killers are my grown-up conduct disorders. Intermittent personality disorder, of course, that's a child disorder also. And again, limited pro-social emotional. Pro-social means that I can feel what other people feel. I'm following the rules of society. So intermittent explosive disorder is not the ups and down. It's just the explosion. You say no, and they tear the door off the wall and all those other things. Okay. There's usually a couple of questions on substances on there. Substance use disorder. Okay, so that's what we're looking for. Substance abuse and substance dependence have been combined into substance use disorder. Okay, so that's what I'm looking for. That whole caffeine disorder thing also. Okay, so caffeine intoxication, caffeine withdrawal. So both of those are still under, it says still under consideration. That's what it talks about. And those are my drugs. Okay, so I mentioned before earlier, it was neurodevelopmental disorder. So now I'm going to talk about neurocognitive disorder. So neurocognitive disorder is neuro is brain, cognitions are my thinking patterns, right? So having changes in thinking patterns is neurodevelopmental disorder that happens as an adult. It is divided into mild and major. Okay, so you can have Alzheimer's and you can have mild or major. Okay, so it's a major neurocognitive disorder or a mild neurocognitive disorder. Anything else about neurocognitive? So you ask a TBI. So a TBI would be a neurocognitive disorder, right? Because my brain is fully developed, but something has happened to affect my brain, right? So now my cognitions are not the same. An interesting question that you might see that the man is 50, and being 50, he has had a head injury or he has some sort of brain event. And you ask him a metaphor, you ask him to explain like a metaphor, and he can't do it. He goes back to the concrete stage, right, of Piaget. Like, so if I ask him, a rolling stone gathers no moss, he's going to literally tell me if I roll this stone, it won't gather moss. So something can happen at that stage where you go back to the concrete stage of thinking as opposed to the formal stage of thinking. That was Alexia. She just want to tell you that. Okay, so let's look at my personality disorders. We've gone back and forth of whether or not they're in clusters or not. So I used to teach them in clusters. Then we stopped teaching them for cluster for a little bit. So now I teach them in cluster again. I don't know if you have to know them in cluster or not. So, but I have seen this is in the textbooks now, back to cluster. So remember, personality disorders, you've had them since childhood. So you don't think it's a problem because you've always been this way. Okay, like, what do you mean it's a problem? I talked to you before about OCD. So OCD and OCPD. OCD is the disorder that is ego dystonic. People with OCD, they are going to come for treatment. They don't like it. They can't leave their house because they're not sure if they check their door 7 times, or they'll drive back to make sure that they turn the oven off, right? So those obsessions, the thoughts, right? Those are the obsessions, and the compulsions are the act. They can't let go of the thoughts, so then the compulsions will increase. So OCD, especially during COVID, those are the ones that you're seeing. Oh my gosh, their hands are raw. Their behavior has gotten a lot worse than normally. Okay. So what I'm looking for is the in OCD, it's the ego dystonic. They're coming for treatment. They believe if they don't follow their routine, something catastrophic will happen. If I don't do everything in 7s, right? If I forget to do everything in 7s, then my mom's going to die. My house is going to burn down. They really believe if they don't follow their routine, right? So remember, your compulsions are your acts, your obsessions are your thoughts. So the obsessions lead me to the compulsions. Okay. So again, they will come for help. That's what makes it ego dystonic. They don't like it. They will seek medication. They will seek help. OCD is going to be an anxiety disorder. So of course, CBT and medication and anti-anxiety or SSRI. OCPD is the personality disorder. And I can bet there are probably at least 5 of you in my class that have OCPD right now. If I come to your house and in your kitchen, all of the spices are lined up alphabetically or maybe by expiration date, or they're all turned the right way. The cans are in order, like the corn is on one side and the peas are on the other side. They can't touch each other. I go in your closet and the shirts that was short sleeve and pink are hanged by the white sleeve and short sleeve, right? They're very, very organized. Okay. So you've had that your whole life, When you were little, your matchbox cars had to be lined up. Oh my gosh, mommy, this Barbie, she doesn't match the other Barbies. You've always been that way, so you don't think it's a problem. Everybody else around you thinks it's a problem, but you don't think it's a problem. Okay, so OCPD, they only want perfection. They don't understand why everybody is not as perfect as they are. Okay, I had a friend tell me, and I had more than one pair of shoes sitting outside of my bedroom. And the conversation was, you only have 2 feet. Why do you have 2 pairs of shoes sitting in the living room? Because it's my house, okay? So my OC people, it's going to be perfect. It's going to be perfect. It's going to be perfect. So you might see the question that they'll turn an assignment in late, okay, rather than turn it in wrong. It has to be perfect, okay? Again, they're not coming for treatment because they don't see a problem. Most often it's their loved one, someone in their life that said, oh my God, you're crazy. But they're not crazy. Ask them. They've always been that way. I did see your hand, but if you will just give me a finished time to get through all of these, we'll go back for questions, okay? Back on personality disorders. I'm closing out some windows because I always have 1,000 open. I think I lost it. There we go. Okay. So cluster A, those are my odd or eccentric. Paranoid personality disorder, remember, they're ingrained since childhood. They don't see a problem. They're not coming for treatment. For the paranoids, what you're looking for is jealousy. They're jealous of everything. They are so sure that their wife is sleeping with the butcher, the baker, the man down the street, and the person that the boss tried to, break in his computer and steal his ideas. Okay, and there's no telling him that he's wrong because he really believes that. So it's not like, my paranoid personality where I'm like, hearing and seeing things. It really is just my personality that, I think that someone's after me. And they've been that way their whole life. If you look back in elementary school, you remember the kid that always thought that somebody was after him. My schizoids versus my schizotypal. Okay, so schizotypal, they are the ones that are typically more like a schizophrenic. My schizoids in general. Okay, so my schizoids don't like anybody. They avoid everybody. You have someone in your neighborhood, or you grew up in a neighborhood where there was someone who was schizoid. You never saw him. You even wondered if somebody lived there. He would get his mail at night when nobody saw him. He comes in, he goes into the garage, and he puts the garage door down, and the curtains never open. He's happy. He doesn't even have a fish. They totally want to avoid anybody else. Okay. Voluntary social withdrawal and limited emotional expression. They are not schizophrenic. They're not having any hallucinations or delusions. That is just their personality. They're fine by themselves. They're not seeking friends. Leave me alone. My schizotypals or schizotypal, I will say they're more typically like a schizophrenic. And when I say that, I'm looking for their thoughts are very bizarre. They will talk to you, but you'll be very sorry that they did. So they like to be isolated, superstitious. They're the ones that might put like the foil on their windows, right? I had a client that I was seeing many years ago, and he would wear the hat with the earmuffs on it. Remember, I'm from South Florida, okay? And he would wear it all the time, so no one would steal his thoughts, okay? So, but again, not having any hallucinations, not any delusions, just bizarre thoughts, schizotypal. Now, don't get schizotypal mixed up with avoidant. So you'll see in the anxious, fearful cluster, cluster C, Avoidant personality disorders, they really like people. They really do. They're just afraid that you will judge them. They're afraid that you will make fun of them. And many times in the question, it'll tell you they've been ridiculed in their childhood. This is what's happened. Their dad or their sisters ridiculed them. So they're afraid of that as an adult. But they really do like relationships. Okay. So I said to you before, by antisocial, they do like people. The word asocial means I don't have friends. Asocial means I don't like society, right? Asocial. Antisocial means I'm anti-rules. I'm anti anything that normal people would do or the average person would do. Literally, those are my serial killers. Those are the people that kill without remorse. Those are the conduct disorders who grew up and never learned empathy. They don't understand how their behavior even remotely reflects anybody else. Okay. So remember like Ted Bundy, and he was charming and he was nice. He was the one in Florida, and he would, pretend he had a lost dog and invite the attractive girls to his van, and he was very harmless, right? And then he would kidnap them and he would kill them. Okay, that's antisocial. Okay, so anybody else that says, oh, they're not friendly, be sure and correct them. That term is asocial. My borderlines, I think I mentioned before, they're the ones that are very black and white. There's no gray between them. They love you, love you, love you, or hate you, hate you, hate you. Okay. DBT therapy, that is by Marsha Linehan. She's considered postmodern. If you sit on the test, she's one of my newer ones. So DBT was written especially for my borderline personalities. And like the term mindfulness, you might see that on the test, especially under like your clinical skills. Mindfulness means to sit in the moment without judgment, good or bad, whatever is happening right now. I'm in this moment and I'm going to take advantage of this moment. If you've seen any of my other videos, I always talk about mindfulness and the importance of being mindful, especially at the test. And I am 56. I took my test in 92. I took my test almost 30 years ago. And there was a pencil and paper test. There was no choice. I'm just saying, I'm old. But I remember being in the room. It was, you really had to be number 2 pencils. They had to be sharpened. But I remember looking around me, and again, I called it gratitude. Now we'd call it mindfulness. But whether I passed or failed, I was in the room. No judgment. I am in the room. Because, when I was going through grad school and undergrad, there were some times I wasn't sure I'd make it this far. Right? So I really just want to just look at the moment. Oh my gosh, I'm in this room. And I always strongly suggest that you do that, whether it's your first time or your 17th time, you're in the room. You're the best of the best. You're in the room. Don't forget that for half a second. You are here. So you are here. Enjoy that moment. Okay. I have a mindfulness app on my watch, not that you care, but it reminds me ever so often to stop and be mindful. Emotional regulation, my borderlines, their emotions are up and down and sideways everywhere. Distress tolerance, borderlines, the minute when things get too rough, they're out of there, right? So learning to be, it can be uncomfortable, but I can deal with it. Interpersonal, INTER, remember that always means with other people. Intercourse is with other people. So interdisciplinary are other disciplines. So I'm always looking with other people. INTRA, intra. Freud would use that. Intra-psychic, that's just me. If I'm in a group and everyone are counselors, that's an intradisciplinary group because we're all the same. Okay, so remember that for the test. Intra, inter, and intra. Let's see here. So my histrionics are always going to be the girls for the test. In the real world, are they? No, they are not. Okay, but for the test, my histrionics are my drama queens. I always tell my clients, if you're a female, if you don't know who the histrionic person is in your girl group, it might be you. It is, I want attention. Look at me, look at me, look at me. Oh my gosh. How dare the world begin? How dare the meeting begin until I get there? Okay. I used to use one that's not there anymore. But if you're old enough to remember Jessica Rabbit, remember Who Framed Roger Rabbit? Like, okay. So the histrionic is, and she, I mean this one, she always dressed this way. And she talked very, very, Jessica Rabbit. Yeah. Yes. Okay. So Jessica Rabbit, right? Oh, Roger. Oh, and the boobs are sticking out. It's like really tight fitted to the butt, right? And you're just going for ice cream. Okay. So that is histrionic. Drama queen. Look at me. Very, very seductive, but not promiscuous. My borderlines will sleep around, not my histrionics. They just want the attention. They're really like, oh my gosh, my boss, he wouldn't accept my Facebook invitation. Oh my gosh, I can't believe this. Okay, so that's what you're looking for. I'll answer that question in just a second, but thank you. Okay, so that's Jessica Rabbit. My narcissists for the test are always going to be men. My narcissists actually have low self-esteem. Okay, however, that you would never know it, right? You are lucky to be on their arms. You are lucky to be in the same room. Oh my gosh, you get to breathe the same air that I'm breathing. Lucky you. Okay, so they appear that the world is all about them. Anyone around them, they may make their children and wife look good only because it makes them look good. Okay. And then my cluster C, I talk about my avoidant, my dependent personality. Those are the people that do not have enough self-esteem to make a decision on their own. It can be that they've been married for 20 years and it's like, oh my gosh, I don't know what milk to buy unless I check with my husband. We've got this 45-year-old man and he still lives with his mother. And not that his mother needs him, but he really doesn't have enough self-esteem to think he can make it on his own. Okay, so I think I covered all of those. So I'm going to go back. So if you remember intercourse, that is always with other people. So if I'm having an interpersonal relationship, it's me working on my relationship with my spouse, my neighbors, my friend, etc. INTRA is just me. So intrapsychic is a intrapsychic energy. That's a term that Freud would use. Like, so all of my stuff that's unconscious. And I said INTRA also. So if I have an disciplinary team, we're all the same discipline. Okay. And when I tell you that, also, like we talk about hypo and hyper, those are just really good terms to put in your notes. When you're writing your clinical notes, oh my gosh, people around you are going to think you're so smart. I'll tell you, you cannot put your job into the test. The test does not care what you do on your job, but you can take the test into your job. You do this anyway. You do this all day, every day. So you can put that into your job when you go to work and you can say, oh my gosh, look at him. I bet he's a borderline personality disorder. And men can be, by the way. Okay, so if you remember intercourse, INTER takes two people. Intra is just me, and there's a whole other word for that I will not share. Okay, so I'm going to go do some questions regarding this, but I want to open up just for questions in general. Something that I covered that I went way fast. You're like, what the heck did she say? But we're going to do some questions to see what these look like in questions. Okay, so anything I didn't cover according to the DSM that you have seen on the test? I like a didactic group that will talk to me. I'm a teacher. I can lecture for like 4 hours straight. It makes it so much more meaningful if you will join me. You could actually just ask me at this point instead of typing it, because I'm done lecturing for a moment. Okay. Okay.
Same. I tested so long ago.
Okay. So I covered more than you usually find on the DSM, on the test, but you never know which ones are going to cover. The big ones are always going to be on there. Schizophrenia, knowing the difference between schizophreniform, bipolar I, bipolar II, they're all going to be on there. Okay. So, and I can't say all, but the assumption is, as a counselor, you know how to diagnose and to treat these disorders, right? And I'll tell you again, it's a reading test. So the reading test means in the sentence, they're giving you enough clues to know what my answer is. They're not trying to make you pull it out of the air, like, oh my gosh, they're giving you the answers. Okay. Okay, I'm going to pull up some questions. And again, I like this to be more interactive, but I also want you to answer in the chat book. There are like 50 people in this group today. And if everybody calls out at the same time, it makes it a little hard to hear. I'm going to pull up some questions and just kind of see what it looks like. So when I finish this, when I finish talking, I'll hit the stop record button, and within minutes, the video will be there. It'll be here for 30 days. On a good day, I'll come back and I'll put a YouTube link in here on the same day. On a typical day, it'll happen later on in the week. Okay, yes, the exact same login, exact same. It is here for 30 days. If you tutor with me or any of my coaches that use Skype, any of my coaches that use Skype, even if you move it to your own box, it only has 30 days. You can, if you move it and you save it someplace, you have it forever. You have it forever on YouTube as long as you have the link. But this chat box will not hold it for more than 30 days. That's one of the reasons I use Skype, right? Because I want you, it'll be here for 30 days. So go back, right click it, right? And then the MP4 version, which will be here in just a few minutes, right click it, save it to your email, save it to any place that you can have access to it. Again, I will come back, maybe tonight if you're lucky, and put a YouTube link in here. The YouTube link, you just copy and paste. You'll have access to that YouTube link forever, okay? You just can't get it through the box. So you have to make sure that you knew how to get into this box. If you were in group with me last week, there's a separate link for every week of group. Okay, and so if you ask me like what happened 4 weeks ago, you go back to that chat room, it's gone. It's gone. Okay. If Prudence is having a good day and she'll share with you, you're in luck. But if not, she'll just tell you it's too late. Okay, so I love Prudence dearly. If you probably are here with me, you've probably gone through Prudence. Prudence has a degree in HR and in business. Okay, so she is my business person. I am a bleeding heart social worker, right? Oh, let's just tutor everybody for free. And she's like, bam, you got to feed your kids. So if you get to know Prudence, she is very black and white. She's a business person. She is not in the soft sciences, but she's amazing because she does everything else so I can teach. Okay. She is very sweet. She really is. She's amazing. Okay, so I'm going to questions. I'm going to go pick up questions for a couple of different places. Autism, what have you seen on the test or other? So autism is not there anymore. We're looking for the spectrum. So you're on the spectrum, and the truth with autism or on the spectrum, you treat the behaviors. There is not a specific treatment for autism. So if I'm having trouble making social skills, making eye contact, we treat it behaviorally. I teach you. And if you've ever seen someone with and we call it Asperger's, who's a high functioning autism, many times you can tell they've been taught what to do. They'll put their hand out and they'll make eye contact with you, because that's a behavioral. So anything that, so Skinner and Pavlov said, I can teach anyone to do anything with reinforcement and punishment. Okay, so people that do not have the cognitive skills learn through behavior terms. Should the ICM be looked into that as well? I think that's pretty deep. I don't think the test is that serious. Each time I take the test, each test I've taken did have schizo questions. Re-listen over and over to this video because Dr. Pam is amazingly smart. Oh, that's not what it says. Thank you. What it says is Dr. Pam made it nice to know the difference. Remember, you're my only social life, okay? This is all I get. Okay, so I'm going to pull up this and let's look at some of these questions. Again, I'm using different test sources because many of you have seen exactly the same ones all the time, and I want you to learn to understand it, to look at it from a different question. Same material, just different questions, okay? Yeah. Number 11, if you'll put your answer in the chat box for me, that makes my life so much easier. And please wait till I finish reading the question to put your answer in the chat box, because that creates anxiety for a lot of other people. So just relax. And I'll also tell you it's a reading test. Number 11, a counselor is seeing a husband and wife in couples therapy. The husband has agreed to participate, although he believes their problems are minimal and not worthy of the cost of treatment. In the sessions, the husband attempts to monopolize the therapy hour by telling stories of all the people that he and his wife have met in their travels. He shows the counselor photos of them with famous people and discloses how well he was treated by these people. He believes that his wife does not appreciate all the 5-star hotels they have stayed in and the lavish parties they have attended. The wife states she would prefer attention from him and a close relationship with him. Which of the following is the following diagnosis? Okay, so for the test, almost always, my narcissists are going to be men, my borderlines and my histrionics are going to be female. Okay, so he is a narcissist. You're absolutely right. So Janet, tell me what words in the question prove to me that he is a narcissist. What words? You can unmute yourself, Janet. Janet's like, no way, Dr. Pam, I'm not answering.
Yeah. I'm here. No, I'm here.
Okay.
What words of a narcissist? It says here, the first one that caught my eye was not worthy of the cost of treatment.
Got it.
So him being there with his wife. And then he monopolizes a therapy hour and then just about him and telling stories.
You got it. You got it.
Him and his wife.
You got it. And all his wife wants from him is attention. Like, just talk to me instead of all these lavish parties. Perfect. That's exactly. So remember, I'm always going to tell you, it's a reading test. They're giving you what you need to know in the stem of the test. Okay. They're not trying to trick you, but you have to know the words that belong to those terms.
Dr. Pam?
Yes.
When I took the test and I failed, I kind of did like a sim map. when you were asking right now and you said, tell me what tells you that it's a narcissistic personality disorder, I kind of wrote down in the marker when I was taking it, okay, I wrote down a map to get the answer. So maybe that's helpful for everyone.
Can you explain more? What do you mean?
So as I read the question, I wrote it like a map to write down the symptoms, and then it would remind me of the category of the diagnosis.
So you would write down like, this is this is that, this is this, and that would help you diagnose. Is that?
Yeah, the symptom, the duration. Yes, that would help me.
Very cool. Very cool. Very cool. I'm gonna again go back a couple of places. So we always see them always from the NCE study guide or something written by counselors. And I want you to get used to not always following those words, because you'll see the words just written differently. So go to. Thank you, Janet.
Thank you, Dr. Pam.
So I am not I'm not a visual learner. And when you told me like write down a map, my heart's like, oh my God, no way. I would die before I did that. But that's just me. That is just me. And I say that to say, when you see on Facebook that someone says I wrote all of my note cards and I passed, don't assume that works for you, right? Know who you are.
I think that's when you said writing down is a kinesthetic learner. Is that what you said? I think, yes. So I don't know what kind of learner I am, but I'm doing auditory, I'm doing visual, and I'm writing everything down and highlighting everything.
So the reason you're kinesthetic and not just visual is because you're writing it yourself. You have to touch it.
Okay.
Okay. So if you're just visual, you'd be okay. And again, there are no bad learning styles, just know yours. So if I can use pre-printed notes, or I can download the flashcards that are typed and printed, then I'm a visual learner. But kinesthetic means I need to touch it. And again, not a bad thing. It is not a bad thing. That is just how you learn.
I'll be on my 4th try, Dr. Pam, and I have no shame.
Okay, so I'm not gonna go there today. I'm just gonna say I'm smiling on. Okay, so okay, number 2. Everybody see that one? Okay, again, if anywhere you see social worker, just put in counselor. Okay, a client strongly feel, again, you're in the chat box. Okay. A client strongly feels as if he or she is the most important person in the room. Which of the following is example of the client's thoughts?
Grandiosity.
Did I say put that in the chat box? I did. Okay, it is grandiosity. Okay. Okay, I say this to say, so many times this doesn't say that he's a narcissist, does it? And I know the diagnosis is narcissist. So what I'm teaching you to look at is what words in the question let me know this is what he's feeling. So people who have those grandiose ideas, those are my narcissists. Okay. And I think the biggest question you'll always see is it's vague. It's very vague. It doesn't like say, according to so-and-so or according to this. It's very vague, and you really have to know them. This won't be on your test, but I think it's kind of funny. Okay. If a client starts to hyperventilate anytime he or she is near water, what is the client most likely suffering from? And I'm going to remind you, there will always be questions on the test that you do not know the answer. You're like, what does that word mean? So you're going to use the base word. Like, so, okay, I see aqua, that means water. Pretty good chance that that's my answer. So if you have no idea, you're going to go with the base word that you know. Okay? So don't say, oh my God, I have no idea, and just leave it. You're smart enough to figure it out. It's a reading test, right? Agoraphobia, of course, is when I'm afraid of going out. I think acrophobia is afraid of heights. Okay. Plebiphobia is the fear of being touched. If you watch any of my videos, you know I do have a fear. I cannot stand concentric circles. There's a word for that, but every time I Google it, it shows the picture. So if you look that up, but don't show me the picture. Number 12. A 45-year-old woman tells her counselor that she worries about her health. Upon further discussion with the counselor, the woman reveals she also worries about her children's safety for no particular reason, her own financial situation, and her job. The woman feels as if she cannot control her worries and wonders if she'll always be this way. According to the DSM-5, the most probable diagnosis for this woman is, and remember, we're not answering the question until I finish reading the question, okay? We're not trying to, it's not groupthink. We're trying to give everybody a chance to process, okay? So we think it's a generalized anxiety disorder. Ding, 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 okay? Let's see here. Deanna, what words in the question that you think that was GAD? Deanna, are you there?
I'm trying to unmute.
Okay. So what words in the question? Because there's not a time frame. I know that GAD is 6 months, but there's not a time frame. So
Okay.
what words?
Let's see.
Thank you. She worries about her children's safety for no particular reason, right? That's it. We're going to prove it in the answer. So generalized anxiety disorder, we don't know why. It's just free-floating anxiety. It is not torn between any of those, okay? So that's what I know. And I know probably what you did was rule out. That's probably how you got here. But I always want you to go back to the question and prove it to me. What words in the question can prove it to me? Somebody asked me, like, how do I know when I get down to 2? Okay, so this is a recall question, right? So either I know or I don't know. Any kind of personality disorder, I'm going to know it's going to say something that Pam has felt this way often, right? And I said before, parent personality is they are jealous. They're jealous that someone is coming to get them. They're jealous that their wife is sleeping around. They're jealous that their husband is trying to take their kids. Okay, so I have to know enough about the diagnosis to know the answer. So I know that major depressive disorder is at least 2 weeks. They can't get out of bed, can't do anything. Oh, should know this one. I'm always going, so if it's a recall question, there's not a lot you can do. You have to go back and make sure that you know the information. But if it's not a recall question, if it's a question that's a vignette, you're always going to prove it to me in the question. What words do I see to know this is the answer? That keeps you from bringing in anything else. The test does not care what you do at your job. But we've always done this, or they don't care. You're following the rules of the test, okay? 13, Ralph, and do not answer in the chat box until I finish reading the question. Ralph, a 34-year-old man who suffered a back injury at work 5 years ago, he frequently enters his session with the counselor using a cane or walker and often needs redirection during the session for talking incessantly. Okay, incessantly means he won't stop talking. about the level of pain he experienced on a daily basis. The counselor knows that Ralph is currently in the process of being approved for Social Security disability payments and believes that Ralph is exaggerating his symptoms for the sole purpose of receiving extra income. What is this called? Answer in your chat box. Factitious or malingering? Okay. Let me see. Adia. Is it Adia? Adia or Adia? Adia. Is that what it is? Yes. Why did you prove what questions and what words in the question prove to me this is the answer?
I exaggerating his symptoms.
And what else?
What else? About the level of pain.
What's he trying to get?
More Social Security.
That's malingering. Exactly. Malingering is I am trying to get something out of it. Factitious, I'm faking, but I'm not really sure. Malingering is I'm trying to get something out of it. The key in the question is, right? He is in the process of trying to be approved for Social Security disability. He's exaggerating his symptoms because he wants the extra money. It is a reading test. Isn't always bad. That is not a test question. It does not ask if it's good or bad. I only teach to the test. Okay, so
Dr. Pam, I have a quick question.
Yes.
So I got it wrong. Actually, I chose factitious disorder.
Okay.
Reason being is because it said he suffered a back injury.
Mhm.
So that's kind of, I guess, where my mind went. I did or hear you say that she believes he's faking. However, my mind just was stuck on that. Even though I read it, it was stuck on the fact that he did injure his back, so he could possibly be whatever. But I think I'm reading too much into it.
Okay, so again, it's a reading test. So you thought a whole lot. So read that question out loud to me.
Ralph is a 34-year-old man who suffered a back injury at work about 5 years ago. He frequently enters his sessions with the social worker using a cane or walker and often needs redirection during sessions for talking incessantly about the level of pain he experiences on a daily basis. The social worker knows that Ralph is currently in the process of being approved for Social Security disability payments and believes Ralph is exaggerating his symptoms for the sole purpose of receiving this extra income. This is called.
So factitious disorder. Okay, so he hurt his back 5 years ago. Is there anything in the question to let me know that his back still hurts?
No.
It's a reading test. If they wanted me to know that his back is still hurting, they would tell me in the answers. It's a reading test. And that's why I'm going to say prove it in the question, because if not, you're going to bring in stuff, the words in your head that are not there. And for most of my students, most of my clients, that's the biggest issue, is you think something instead of reading something. So if you could all just leave your thinking caps at home and just read on the test, it would be great. Factitious disorder, they go to the hospital. They might. Factitious disorder, they really might go to the hospital. Malingering disorder might also. Okay, but the difference is in the question, it's going to be very clear that he's trying to get something from it. That's the key that makes it malingering disorder. Okay, there's not a trick test. It is knowing your DSM and knowing what we're looking for. That simple.
And
But what if? We don't care what if. Go ahead. Sorry.
Dr. Pam, I'm so sorry. You're mentioning something very important that I want to highlight. And you're saying, do not answer until I finish reading the question.
All of the responses too.
Exactly. And when I was taking the test, I know I got very excited, and you see something like we could have clicked factitious instead of malingering just because you didn't take your time to read it. So take your time.
That's my issue. So thank you.
Not only take your time, Okay, but prove it to me in the question. Even if you're sure you know the answer, prove it to me in the question. I want to know what words you see in the question, okay? And not what you think. Well, my supervisor said, I don't care. The test doesn't care. They just care what's in these lines, okay? Again, do not answer this until I finish reading. A serious impairment in social communication with that lack of ability to engage in social relationships is often found with an individual with what? A, major depressive disorder, B, dissociative disorder, C, social phobia, or D, autism spectrum disorder. I'm going back to the question. Impairment in social communication, along with the lack of ability to engage in social relationships. Okay, so I should have ruled out major depression. A is not going to be it. It's not going to be dissociative disorder either. So I found this on the web. Thank you, Alexa. So it should be between C and D, right? I should be going, okay, it's either C or D. I'm going to compare the two to each other. Okay. So I know that the spectrum disorder, right? They do have difficulty communicating with others. Let's see, C and D, C and D. What do I see the most of C's? It's D. Okay. The words in the question. Go ahead.
This is why we fail.
Okay. So wait. Tell me why. Tell me why.
Okay, because I'm thinking impairment in social communication along with lack of ability to engage in social relationships. So I'm thinking social phobia. Okay, the key here, Dr. Pam, is impairment for autism spectrum disorder.
So the key is impairment in social communication. Okay. The relationship part is social phobia, right? I'm afraid of people.
Yeah, I got it.
Okay. So, but a social phobia doesn't mean that I have difficulty communicating. That doesn't mean that.
True.
Right? The phobia is I'm afraid of being with people. I'm afraid of being out. The issue with communication was the clue.
Okay.
Okay.
You have to
and I'm going to tell you, it's not a trick test. They're not out to get you. Slow down and read. Forget everything that you thought you knew and read. Okay.
Yes, Dr. Pam.
I said to everybody, okay, it's fair. And that's the problem with most of my students is you are thinking. I don't need you to think. I need you to read.
I think my issue, so I automatically went with D.
Here we go. Again, do not answer until I finish the question. Whitney is a 30-year-old woman seeking services from a social worker due to feelings of depression. Whitney has felt extremely sad for about 1 week and has not been able to get out of bed one day due to extreme fatigue and depressed affect. Remember, affect is mood. It's kind of look on your face. She has stopped eating and cries all of the time. When considering a diagnosis for Whitney, why might the counselor not give her a diagnosis for major depressive disorder? Okay, so why would they not? Okay, I know it's not E because I know major depressive disorder does not include any hallucinations, right? Okay. So B, Whitney has not shown symptoms for depression long enough. Let's hold on to that one. C, Whitney has been able to get out of bed at least once. Or D, Whitney does not complain of feelings of worthiness. So in this one, it's a time frame issue, right? How long is major depression?
2 weeks.
Exactly. Okay. So once you know that it's 2 weeks, do you not see how easy the test is? Who said I'm done? Tell me why this was so hard. It's the JW. Okay. Do you want to unmute yourself and talk to me? I won't bite you.
You're so silly. I'm just done. I'm done.
It's so hard.
Okay. Can you share your process with me? Just what was your thought process?
Like you know, the reading part. Like I see one word, I'm like, oh, let me go straight for that one. But you have to read the answers as well too as the question. Don't just see like a certain word and just jump to that word.
You got it. You got it. You got
Oh
it.
yeah.
You got it. And
I'm
what's
like,
going to happen? Thank you. You're not the only one. Thank you for sharing. Thank you. Thank you. Thank you. So what I'm teaching you is our test taking skills. Most of you have never learned test taking skills. Okay. So you've gotten by on your smarts because you're really smart. And I'm teaching you a new skill. And every time you learn a new skill, it's difficult, right? If you go to McDonald's tomorrow and learn to flip burgers, there's a learning curve, right? I'm sorry, I don't like the new skill, but the new skill will help you pass the test. The skill is why people besides you are licensed and don't know crap. Okay, so I just face facts. Okay, so learning the skill, and what happens if we don't practice the skill, we'll lose it. Okay, so when you're taking test questions, when you're practicing, when I'm not in your ear, it's the same thing. Okay, these are test taking skills. Got it? And that's one of the issues if you only use the purple book. Right? Because the purple book gives you tons of content, right? But it doesn't tell you what that looks like in a question. It's a reading test. Okay? Exactly. Well, okay. So you know what? Even if you start at Mickey D's and you learn, you're there for like 3 months, you learn, and you come back, there's going to be a new way to flip burgers. Okay. You're still going to learn a new skill. Your job does not have you overanalyzing. Your head has you overanalyzing, not your job. Take your job out of this question.
Dr. Pam, I have a question, if you don't mind. Oh, can you hear me?
Yeah,
how have you seen somebody take this thing like 20 times and just never pass it?
No, the most I've ever had was I think she took it 16 times before she met me. So no.
Okay.
If you tutor with us, what we do is you tutor with us. With 3 times a week. I'm sorry, twice a week for 90 days. We have a 97% passing rate. So 3 times a week, twice a week for 90 days, and don't test until the coach tells you're ready to test. If you don't pass, we'll take you through the whole program again, no charge.
Yeah, like I just today started with Miss Joyce, and she's amazing, but I just feel overwhelmed.
But it's okay. It's okay. There's a lot of information. It's really okay. Really, we want you. The goal of my agency, my program, is this stupid sheet of paper should not stop you from doing what you need to do. Oh my gosh, it shouldn't. This is not, it's not an achievement test. I'm sorry, it's not a predictor test. It doesn't predict how well you're going to be a counselor. It does not, right? But this stupid sheet of paper will keep you from getting what you need to get. So we got to learn this skill, okay? Okay, so last one, guys. Which of the following best characterizes a core symptom of borderline personality? Okay, so borderlines, we talked about that. DBT, that's the treatment for borderlines. Okay, so which of these, okay, is a core symptom? So that means some of them may be symptoms, but what is the core system, the primary thing I'd look for? A, alternating periods in which the affective extremes are prominent, ranging from elation to despair and depression. B, persistent feelings of superiority compared to others. C, fear avoidance of rejection by others. Or D, periods in which significance significant others are perceived as having malicious intent toward the diagnosed person.
Is it A?
Okay, so let's stick with this for a question. Persistent feelings of superiority compared to others. What personality disorder would that be?
Narcissistic.
Yes, it would be. Okay, C, feeling or avoidance of feeling and avoidance of rejection by others. What personality disorder is that one?
Depression.
Avoidant personality.
Avoidant personality. Okay. Depression, I'm looking for, I can't get out of bed. I'm sad. I feel worthless. So they're very clear words when I'm looking for depression. Okay. And then D, periods in which significant others are perceived as having malicious intent toward the diagnosed person. What would that be? I think someone's out to get me.
Paranoia.
Paranoid personality disorder. Exactly. Okay.
Would that be the what is it called?
What?
It was
Sorry.
C, fear of avoidance. Let's see why.
Oh, Dr.
The alternative
I am so
extreme-
confused.
Hold on. In which extremes are prominent, ranging from elation to despair and depression. That probably sounds more like a bipolar, doesn't it? So C, while it does describe an avoidant personality disorder, it also talks about borderlines. Margaret Mailer said that if we do not have that attachment, that one person, that we really could end up being a borderline personality.
Dr. Pam, I just have a quick question.
Uh-huh.
Would D describe someone who has the persecutory belief system? Would that fall under that?
So persecutory are delusions, right?
Okay.
So that means that I'm thinking, I see something in the question that I am thinking that they're out to get me. I'm thinking that, so it's a thought disorder as opposed to an actual behavior.
Gotcha.
Okay. Okay, so we're going to do another one. Okay, here we go. 1 month ago, a client experienced a panic attack on the beach when she thought she was drowning. Now the client starts to tremble and feels faint whenever she's near the beach. Which of the following disorders is the client most exhibiting? A, conduct disorder, B, adjustment disorder, C, panic disorder, or D, separation anxiety disorder.
So it is going to be B, adjustment disorder, because it's within that 1 month that this client experienced this in the beach.
No.
Oh.
Put your answer in the chat, but that's not it. Put your answer in the chat. Thank you very much, but no. Okay, so I see where you said, I see where that adjustment disorder, okay? Adjustment disorder does not say a month. There's not a time frame for an adjustment disorder. What we're looking for is, after some point, it's not just adjustment disorder. So that is not my answer, okay? So a panic disorder is when I've had one panic attack and I worry about having one for the next 30 days. So that's the time frame you were looking for.
It says panic attack.
What? In the question? You read the question?
Yeah, that's my point. Like,
What?
If you just read the question and not think what you think you know, just read the question.
So, and really, I don't mean, I'm not trying to make you feel bad. I would never do that to anyone. I just want you to understand how the test is written. Everybody in the nation takes the same test. This test was written by upper class white men. It was written by that, and it was made for upper class white men. So you cannot bring anything else in your personal life into this question. That is just a fact. That's a diagnosis. Conduct disorder, I think I talked about earlier. Conduct disorder is in children. We diagnose that from 6 to 16. My conduct disorders are the ones who are going to, they have no empathy. They're the ones that poke the animal's eyes out. They'll set the cat's tail on fire because they really have no empathy. They don't understand that their behavior hurts someone else. Okay. You need to read like an upper class white man. That's what you need to do. Okay. So that's it.
Hey,
that's
hey,
it. That's all I needed to do. Go ahead.
So can you do me a favor? Can you just refresh my memory for adjustment disorder?
I can't. I'll Google it for you. How about that?
I'm sorry?
I'll Google it for you.
Thank you very much. Oh, I could have done that.
I do like to Google a lot, but remember, if you have to know the source, you have to check the source to make sure that it's something reliable. And we know that Wikipedia is always right. Okay, we get a.
Thank you very much.
That was a joke.
Oh, wait, that was my. It's a comparison, not like that one. Oh, let's just go to the DSM. Okay. Adjustment disorder is stress-related, short-term, non-psychotic disturbance. The comfort and distress and turmoil and anguish to the patients are significantly, and there's a reason why. You can always see the reason why. Okay, let me see. Go back to another one. What I'm looking for in an adjustment disorder, I am looking that something happened. She just started a new job. She just, what else? I'm always thinking of something that what I'm looking for in the question. I'm adjusting her. My kids all went away to school, right? And I've had a huge adjustment. Having emotional or behavioral symptoms within 3 months of a specific stressor. Okay, so I'm going to see in the question something very specific happened. A child removed from his home would have an adjustment disorder. He would probably have acute stress disorder. If you remove me from my home, I'd probably go into like, oh my God, trauma, to be honest. Okay. Antisocial. Somebody tell me again, what is antisocial?
Ted Bundy, Jeffrey Dahmer.
Got it. So what happens, so remember, personality disorders start in childhood. All of them start in childhood. So if conduct disorder is untreated in childhood, once you're an adult, that's antisocial behavior. Okay. Okay, guys, I know you have had the amazing amount of fun with me for the last 2 hours, and you could think of nothing else you'd rather be doing on a Saturday night. Questions, things I didn't cover, things that you're not sure of.
I just have a quick question about how to sign up for the groups, or not the group, but the
So everything is on our academic coaching for World Changers website, or you can always send an email to Prudence and she will tell you exactly what you need to do. Okay, that's for Dr. Pam 2020 against gmail.com.
Okay.
And if you haven't met Prudence, Prudence is my director of operations. She handles everything, so I can just teach. All I want to do is teach. I don't care if you've paid me. I don't care if you miss a session. She, on the other hand, will come after you. So it lets me do what